The statistics are staggering. Nearly 30 million people in the U.S. have diabetes, and another 86 million are at risk for developing type 2 diabetes. And those numbers continue to grow. November is American Diabetes Month, so we've brought together a team of experts to shed light on the epidemic and talk about what needs to be done to combat the problem. Joining me now is Boynton, the Executive Director of the American Diabetes Association, Carole Demarest, the Education Coordinator at the Center for Diabetes and Metabolic Care at St. Francis Hospital, and Beth, a plastic and reconstructive surgeon. Thank you all so much for being here on Style today. And you're all very familiar with the problem of diabetes, kind of in your own way, in your own profession. So Chris, I'll start with you. And how big of a problem is diabetes in Connecticut?
We know there's a little less than 200,000 people in Connecticut who are living with diagnosed diabetes. That means there's probably another 50,000 Connecticut people who don't know they have diabetes right now.
And Carole, good nutrition is critical to deal with diabetes, correct?
It is, yeah. We know that having a healthy, balanced diet, as well as watching the portions of the foods that we're eating, is really helpful with managing the disease and also with preventing it.
Sure. And Beth, typically when a patient comes to you, it's not good.
No, I'm hoping that everybody sees people like these guys who are going to prevent the problems that eventually come to me. You don't want to be seeing a plastic surgeon when you have diabetes.
Sure. Chris, I think we'll have you explain for our viewers the difference between type 1 and type 2 diabetes.
Sure. Diabetes is really about insulin, and insulin is made by our pancreas. People with type 1 diabetes, which used to be called juvenile diabetes, don't make any insulin at all. So they need to inject insulin or have a pump that pumps insulin into them every day. People with type 2 diabetes, their pancreases don't work quite effectively, and either they don't make enough insulin or their insulin is not strong enough to help turn their food that they're eating into energy.
This is something you say people who are diabetic think about it constantly.
They do. When you're living with diabetes, you have to be thinking about how the food you're eating, how the exercise you're doing, if you had a stressful day, if you're a little bit sick, you have a cold, all those things affect your blood glucose levels, which affects your health.
And you say there's kind of an urgency to get this message out.
Absolutely. The numbers, like you said, continue to grow, and we're talking about an epidemic that threatens to bankrupt our healthcare system because so many people have it and it's so expensive to treat.
And Carole, we'll move back and talk a little bit about diet now. Are there ways you could prevent diabetes by eating correctly?
There are. There was a great research study that was done years ago, and what they show is that people who have pre-diabetes, so their blood sugars are not normal anymore, but they're not quite high enough to diagnose diabetes, when they took steps and made lifestyle modifications with modest weight loss and exercise, and that included a healthy, balanced diet, they were able to reduce their risk of developing type 2 diabetes by 58%. Wow. And if they were age 60 and over, it was a 71% reduction in the risk of developing type 2.
So if you're already diagnosed with diabetes, how does your diet affect it? What are some of the things that you have to keep an eye on?
Well, we still want people to know that they need to have a healthy, balanced diet, just like anybody else. But the foods that we, like Chris mentioned, that turn into glucose are carbohydrates, which are our main source of energy. We really need to pay attention to the portions that we're eating, how much we're eating at one time, because they'll get converted into glucose at that time of that meal. What their day is like, what their schedule is like, what are their food preferences, and come up with a healthy eating plan that works for them, but can also manage with their medicines and exercise routine to control their blood sugars.
Sure, I understand there's something called the plate method, if you describe that for our viewers.
Yeah, it's a very simple tool that anyone can do at home, whether they have diabetes or not. And if you basically take your dinner plate, preferably a 9-inch plate. Okay. We know the American dinner plate has expanded over the years. A 9-inch dinner plate, and you divide it into 4 sections. You can take 2 of those sections, or basically half your plate, and we want to put non-starchy vegetables on those. So your broccoli, your carrots, your cauliflower, your green beans, any of those wonderful vegetables that are very low in calories, high in fiber. And then the other 2 sections, we want to have some lean protein. So your chicken or turkey without the skin, your fish, your lean beef or pork. And that should really be about the size of your palm.
That would be a serving?
That would be a serving, yep, not your whole hand, just your palm.
Okay.
And then the other section would be some sort of grain or starch. So that would be your pasta, your rice, your potato.
It's really good for anybody to live by, really.
It is, it really is.
Just healthy habits.
Most women's fists are about a cup portion size, and that's usually about a quarter of your plate. So when we
Good to
think
know.
of eating pasta or rice at our meal, it's usually not just that little quarter of the plate, it might be the half of the plate.
Sure.
So just by decreasing that portion, we're decreasing our carbohydrates and filling up with things that don't convert into glucose, but also might be less in calories and more nutritious for us too.
Something you have to really pay attention to. And Beth, as you said at the top of the show, once people come to a plastic surgeon for diabetes, it might be too late. It's probably not a good sign. What are some of the complications that you are seeing?
Well, the thing that I see in my practice, or have in the past seen in my practice, is people who have feet problems as a result of their diabetes. What happens with more the end-stage diabetes that hasn't been controlled very well is that people get poor circulation in their feet, and they don't feel. They get neuropathy. So they're numb sometimes down in their feet and even up toward the knee. So they're putting their feet in shoes that may have a stone in them and they don't feel it.
And that's causing damage.
They develop a wound, and then their blood supply is not very good to heal it. So they get a wound on their foot essentially that is extremely difficult to heal, and sent to me to try and get the healing done. And sometimes we're successful at that, and other times we're not. So the goal is to manage your diabetes well, and to keep the sugars down, have your diet be very good. And also every day when you're putting that shoe on, reach your hand in it, feel for stones, make sure the padding is good and that you're not going to develop these wounds, and check your feet every day so that you avoid having the problem that I'm going to have to see you for.
Sure, that makes sense. And Chris, we have about 30 seconds left. Is there something you want to leave our viewers with, a message they could take home with them?
I just think that we need to create a greater sense of urgency around diabetes. It is an epidemic. It's sweeping across through our families and our society, and we need to do something more about it. We did something about drunk driving. We've done something about people not wearing their seatbelts, and we did something about people smoking. You know, just 20 years ago, 60% of the American population smoked. We need to attack diabetes with that same sort of urgency.
This was a good start. I want to thank you all for being here today.